In recent weeks, you may have heard the term viral load being used more often as more research on the coronavirus comes out and leaders give updates.
So what exactly are they referring to? News 6's Carolina Cardona explains.
The viral load with the Delta variant is about 1,000 times more than previous variants. That's a big difference.
As researchers continue to study COVID-19 and the Delta variant, we're hearing more and more about the viral load, which Dr. Todd Husty, Seminole County's medical director, says the terminology began several decades ago.
It's something that we started talking about with HIV was viral load, and you could see how much virus somebody had in them. And it's sort of a measure of so how much activity does the virus have right now? It's how much virus is in us.
With the Delta variant making its way across the country at a high rate, Dr. Husty says he wasn't surprised to see this new surge of COVID-19 patients.
With the Delta variant, it's much more communicable. That was a bit of a shock as how communicable it was. But did the surge surprise me? And the answer is no, because we stopped doing all the things that we're supposed to do to keep the virus down.
If you take a look at the Delta variant, what we saw very early on was that it spread really fast through India, through the UK. So we knew it was a much more transmissible variant.
Dr. Cameron Webb is part of the White House COVID-19 response team.
We have studies that have now shown that even on the first swab of somebody with the Delta variant, you're seeing almost a 1,000-fold increase in the amount of virus.
The thing that's important, and that is new data that we've seen just in the last several days but corroborated several times, is that if you are vaccinated and you are one of those rare breakthrough infections, you actually have the capacity to pass it to somebody else.
Dr. Husty says those breakthrough cases shouldn't deter others from getting their COVID-19 vaccine shot.
Just because we have breakthrough cases doesn't mean that you shouldn't get vaccinated, because most people have great advantage to being vaccinated. One is you're probably not going to get the disease. Two is if you get it, it's going to be mild. And there are studies from all over the world that are supporting that, even with the Delta variant.
In Orlando, Carolina Cardona, News 6.